Hello, everyone. We might make a start. I know there are still people joining us, and that might continue for a few more minutes, but let's make a start for tonight's session. So, welcome to the New South Wales Family Daycare Association PD in Your Pocket series. My name is Debbie Cole, and I'm actually going to be your facilitator for this evening. Before we begin, I would like to acknowledge the traditional owners of the country on which we meet today. I know we are on many different lands with many traditional owners, but I'm currently presenting from the land of the Wurundjeri people, and I would like to acknowledge them and recognise their continuing connection to land, water, and culture. I'd like to pay my respect to their elders past, present, and emerging. I acknowledge that Aboriginal families have cared for and educated children on this land for tens of thousands of years and will continue to do so into the future. Before we start our session, I would like to let everyone know about a great opportunity for professional development that's coming up on the 26th of October, the Online Educator Forum. This is a wonderful chance to hear from some amazing speakers and build your skills and knowledge further. Details about this forum will be in the group chat, and we encourage you to register for this exciting PD session. So let's get started. As many of you know, this PD in Your Pocket is funded by the New South Wales Government. Hopefully everyone received and has had a chance to read the resource booklet. We sent you a link to the topic booklet last week. However, if you didn't receive one, you can find the link on the screen if you're watching the presentation. But if you're actually listening to the podcast, the link is www.nswfdc.org.au/PD in your pocket. And also just a reminder about the survey you will be sent after the session. We really encourage you to fill in the surveys, as this helps us to get funding that we need to continue providing this training for free. And we really appreciate people who have taken the time in the past to fill out last month's survey and some of the previous ones as well. Your certificates will be emailed to you within a week if you are in the live session, and we encourage you to just check your junk email because sometimes that's where it will land. If you still haven't received your certificate within about a week's time, we encourage you to contact info@peaktraining.edu.au just to check where that's at. Now, I would really encourage you to use the group chat to ask questions and share your own ideas and strategies as we go through the session. I know you all have a wealth of knowledge and experience, and using the chat group is a really great way for you to ask questions and also potentially have some of those questions answered by your colleagues, and also share some of the wonderful practices and practical strategies that are part of the work that you do as family daycare educators. We will hopefully have some time at the end of the session for a few questions as well. So during the session, I encourage you to use the chat space for your questions, and hopefully at the end, we can also answer a couple of those questions that you might have if they haven't been answered throughout the session or from some of your colleagues. So what are we covering tonight? We're going to have a bit more of a look at what is active supervision. We're going to talk about some of the benefits and challenges around active supervision. We're also going to look at what the national law, the regulations, and the national quality standard, the EYLF and My Time, Our Place say about supervision. We're also going to look at some strategies to support active supervision, and we're also going to look at what it really means in practice. You may remember we actually asked some questions when you registered for the session, and this is what we learnt from you. It's really terrific to see that 79% of you know the difference between adequate and active supervision, with only 16% of you being a bit unsure and 5% of you not knowing the difference between the two. We're going to talk a lot more about adequate supervision and active supervision throughout the session. So hopefully it'll give you a little bit more understanding and clarity around those two terms. It was equally impressive to see that 78% of you are aware of the requirements in the national law and regulations and the national quality standards around active supervision. Only 11% of you were unsure, and only 2% of you were not aware of the current supervision requirements. In relation to how confident you feel about supervising children and keeping them safe from harm and hazards at all times, 89% of you are confident, 10% somewhat confident, and only 1% of you feeling a little bit unsure. This session will really help you to increase your knowledge and confidence, and hopefully will also affirm a lot of the practices that you already are doing and have in place. So what is active supervision? Supervision is a key part of your role as an educator in family daycare. We know it's a legal requirement, it's an element of the quality standards, and it's embedded in practice throughout the early years learning framework and My Time, Our Place. We know when children are supervised effectively that our families can really feel assured that their child is safe in your care. Children also have a right to feel safe and protected when they attend family daycare or any other education and care setting. Supervision is about keeping children safe and protecting them from harm and hazards that may arise in their daily experiences as they play, interact with others, and as they move through their daily routines and transitions. And this is often what we describe as adequate supervision. However, active supervision involves more than just preventing or responding to potential or actual harm and hazards. It really requires the educator to be actively involved with children and have knowledge of what each child is doing at any given time of the day. Active supervision is the most effective strategy for creating a safe environment and preventing injuries in young children. What it really does is it transforms supervision from a passive approach to an active skill. Active supervision involves continuous monitoring of children's activities, their interactions, and the environments, and is really much more than simply watching or observing from a distance. Active supervision really emphasises the importance of being present, being tuned in, and actively engaged in children's play and learning. By being near children and aware of their abilities and needs, you can really prevent incidents and address any issues that emerge very, very quickly. However, this doesn't mean that you necessarily have to be directly playing or interacting with children all of the time. Active supervision is also about putting yourself in the right position, scanning, listening, keeping a watchful eye over children while you might be attending to another child, parent, or perhaps preparing food. So, why is active supervision so important and what are the benefits? Active supervision is both a professional and ethical responsibility, and it has many benefits for children, for families, yourself, and your service. Let's start with safety. By actively supervising, you can prevent accidents and other potential hazards, and you can really ensure the safety and well-being of all children at all times. This also means that you're complying with legislation, you're meeting the standards, and you're implementing your service policies and procedures. In relation to assessment and planning, active supervision and engagement, it really creates lots of opportunities for you to assess each child's strengths, interests, and how they relate to other children and adults. And these assessments provide valuable contributions to how you plan the program and can really help increase your understanding of children. Positive learning environments. Active supervision creates an environment where children feel secure and supported. It promotes positive interactions and encourages learning and exploration in ways that are safe and developmentally appropriate. Considering supervision requirements when planning and reflecting on the environment can help you to adapt experiences and equipment to really suit children's developing skills and agency while still keeping them safe. In relation to relationships, through active engagement and supervision, you can promptly address children's needs, whether it's helping them with the task, whether it's resolving conflicts, or providing emotional support. Being near children really enables you to build responsive relationships and be aware of any situations that need quick attention or perhaps more attentive supervision. Role modelling is really important. When you interact with children during playing routines, you model positive actions, language, problem solving, and social skills. Active supervision is a great way of teaching and supporting children to develop many of these skills. Inclusion. Active supervision ensures that all children, including those with diverse abilities, are included and have equal access to learning experiences that are safe and stimulating. As you may be working with children of different ages and abilities and skills, effective supervision ensures that the program is safe, stimulating, and inclusive for every child. Partnerships with families. Actively engaging with children enables you to genuinely know each child. You can assess their learning and development and use this information and share it with families. Exchanging meaningful information about children is a great way to build relationships with families and also enables you to learn more about a child and plan for their supervision accordingly. There are so many other benefits that may be specific to your context and community. And you might be able to think of some other benefits of active supervision, and you might like to share some of your thoughts in the group chat. So feel free to use the group chat to add your own thoughts and ideas and some benefits that you feel are really relevant to supervision. Although you may be following policies and procedures and you understand the importance of active supervision, we also know that there are lots of factors that can really impact on the effectiveness of supervision. Firstly, you're working alone. Being solely responsible for a group of children requires you to be much more vigilant and consider how you're going to manage supervision across different areas, times of the day, and during different routines. You also work with children that are diverse in age, ability, and need. And supervising diverse groups of children, as we know, can be quite challenging as their routines, their needs, their skills might differ greatly. And this might require you to supervise children in very different ways, which again can be quite challenging if you're working alone. Managing daily tasks is easy sometimes to be distracted by other tasks, people, technology, or unexpected events, which may lead to lapses in concentration and sometimes that ability to really be actively engaged and present. We know outdoor spaces can often have more variables or things like uneven terrain, the natural elements, and they can be quite unpredictable as well. And we know that sometimes that requires much closer supervision and monitoring. You may need to also conduct risk assessments to ensure that outdoor play and local outings are well supervised. It's also about knowing individual temperaments and experience, I should say. Some children might be more impulsive, adventurous, or prone to wandering, and this also might require a little bit more attention and close supervision. During routines and transitions, for example, arrivals, departures, if you're moving from one area to another, during meals and sleep, you might need to be more aware of children's actions and safety and monitor them closely. You might also need to give them more attention, and particularly to one child during these times, and that can make it really challenging then to supervise the rest of the group. Long hours and stress can also impact on your ability to be fully present and engaged. We also know that there are many other factors that might also impact on your capacity to supervise children effectively. Being aware of some of those challenges and issues that may limit or make supervision difficult really enables you to reflect on your own personal and professional practices. And hopefully, it gives you time to think about how you can really address these situations and make sure that they are minimised or unlikely to occur. Regular audits, checks by yourself and service leaders can also help to manage any potential risks and challenges. You might also like to think about what other factors impact on your capacity to supervise children effectively. And once again, feel free to share your thoughts, your ideas, and any strategies in the chat group. Let's look at the big picture. Supervision is part of the Education and Care National Law and Regulations and should be reflected in all your service policies and procedures. As an educator, you need to be aware of the legislative requirements and follow specific policies and procedures related to supervision within family daycare. Service leaders should also ensure that all staff are informed of any legislative changes and update policies accordingly. The Education and Care Services National Law requires that all children being cared and educated for at an approved service are adequately supervised and are protected from harm and hazards under the following sections. Many of you will be familiar with these sections and these regulations, but I'll just go through them in a little bit more detail. Section 165, an offence to inadequately supervised children. It's important that the approved provider of an education and care service ensures that all children being educated and cared for by the service are adequately supervised at all times that children are in the care of that service. As a family daycare educator, you must ensure that any child being educated and cared for as part of a family daycare service is adequately supervised. Section 1.67, an offence relating to the protection of children from harm and hazards. And there are two areas that you need to be aware of. The approved provider of an education and care service must ensure that every reasonable precaution is taken to protect children being educated and cared for by the service from harm and from any hazard that's likely to cause injury. A family daycare educator must also ensure that every reasonable precaution is taken to protect a child being educated and cared for as part of a family daycare service from harm and any hazard likely to cause injury. Section 174, it's an offence to fail to notify certain information to the regulatory authority. And 174A, again, family daycare educators notifying certain information to the approved provider. So these are some important parts of the national law that are important for educators and service leaders to be aware of. The national regulations further require that regulatory authorities be notified in case of any serious incidents or complaints alleging compromise of the safety, health, or well-being of children. There are also very specific regulations related to supervision, and these include Regulation 84B, which is about policies and procedures addressing supervision during sleep and rest. 84C, a risk assessment for the purposes of sleep and rest policies and procedures must consider the suitability of staffing arrangements to adequately supervise and monitor children during sleep and rest periods, and also the consideration for the level of knowledge and training of staff supervising during sleep and rest periods. Regulation 101 is about risk assessment, considerations during excursions. Regulation 102, items to be included in a written authorisation as part of an excursion. 102 AAC, risk assessment considerations for the safe arrival of children. 102C is about risk assessment considerations for transportation of children. Regulation 102D, items to be included in a written authorisation for transportation of children. Regulation 168, policies and procedures are required in relation to providing a child-safe environment. 176 is about timeframes for notifying certain information to the regulatory authority, and 176A is about prescribed information to be notified to the approved provider by a family daycare educator. So, as you can see, there are quite a lot of regulations and laws that are very specific related to supervision. So, it's really important for educators and service leaders to not only be aware of these regulations and these laws, but to really make sure they are embedded in policies and procedures and are part of the everyday practices in family daycare. Many factors might contribute to a hazard, such as a lack of a quality program, inadequate supervision, and worn equipment. Approved providers, nominated supervisors, and educators are required to develop, implement, and monitor procedures for identifying, mitigating, and where necessary, preventing hazards. Adequate supervision is essential to keeping children safe and protecting them from harm and hazards. What adequate supervision means is that you as an educator can respond immediately, particularly when a child is distressed or in a hazardous situation. It's also about knowing where your children are at all times and monitoring their activities actively and diligently. You need to balance supervision and engagement by drawing on a range of different skills, and that might include things like positioning, scanning, observing, monitoring changes in noise and stress levels, and being aware that children of different ages and abilities are going to need quite different levels of supervision. The national regulations and the national quality standards refer to adequate supervision. This can be determined and planned for by considering a number of different factors, including the number, age, and ability of children, the number and positioning of educators. And while the number of educators may not be relevant to family daycare, it is important where you position yourself. Each child's current activity, what are they doing at different times of the day? accessibility, visibility of areas where children are actually playing, risks in the environment and experiences provided to children, including excursions and on any transportation that's provided or arranged by the service. Your knowledge of each child and each group of children, the experience, skill, and knowledge of each educator. In family daycare, particular consideration should be given to the layout of the areas of care, the number of children attending, and supervision during periods of rest and sleep, and also in toileting and nappy change areas. Being a family daycare educator means you've probably already undertaken a variety of risk assessments and safety checks to be compliant with the national law and regulations. Your service will provide a range of policies and procedures that you'll need to become familiar with and consistently implement. Although the service will have considered many of the factors related to supervision, being proactive and ensuring supervision is not only adequate but tailored to your home setting will ensure the children in your care are always safe and protected. As we've mentioned, there are a whole lot of other regulations that are also related to supervision. And these include things like the use of tobacco, drugs and alcohol, sleep and rest, risk assessment, excursions, arrival and departure, and transportation. So you also need to be aware of some of these other regulations and how they also inform your policies and procedures, your day-to-day practice, and your supervision of children. Supervision is also a key part of the National Quality Standard. The importance of actively supervising children to promote their health, their safety and learning is reflected in Quality Area 2 of the National Quality Standard, Children's Health and Safety. In particular, Standard 2.2, each child is protected, and Element 2.2.1, at all times, reasonable precautions and adequate supervision ensure children are protected from harm and hazard. The focus of this element is to ensure that children's safety is protected at all times, including on excursions and during transportation that is arranged by the service. It's also about creating safe physical and social environments that have a positive impact on children's learning, development, and well-being. The following examples highlight what might occur during assessment and rating, including what assessors might observe, cite, and discuss, particularly in relation to supervision. They might observe educators ensuring that all children are adequately supervised, that educators are supervising children closely when they are in a situation that presents a higher risk of injury. And for example, that might be during water play, woodwork experiences, or perhaps on an excursion or during transportation. That educators are adjusting their levels of supervision depending on the area of the service and the skills, age mix, dynamics, and the size of the group of children they are supervising. It might also be about talking with children about safety issues and the correct use of equipment and the environment, and where appropriate, involving children in setting safety rules. They might also observe educators discussing sun safety with children and implementing appropriate measures to protect children from overexposure to ultraviolet radiation, such as sunburn. It might also include monitoring and adequately supervising sleeping children according to the service's policies and procedures around sleep and rest. Specific questions and examples of documentation for family daycare may also involve some of the following: how educators are involved in identifying and managing risks to maintain adequate supervision, how educators promote engagement in children's play and experiences while maintaining supervision requirements, how educators ensure that supervision requirements and arrangements are flexible to allow for supervision of individuals or small groups of children, such as when children are sleeping, or indoor and outdoor experiences are concurrently offered to children. How educators balance supervision requirements with children's needs for privacy and independence. It might also include how the service ensures that children are not left alone with visitors to the family daycare residence or approved family daycare venue. How the service plans for and manages risk associated with overnight supervision. How the choice of sleeping spaces supports adequate supervision. Evidence that a record is kept of all visitors to a family daycare residence or approved family daycare venue that includes the signature of the visitor and the time of the visitor's arrival and departure. You can find more information about supervision and the National Quality Standard on the ASIQA website and in the Active Supervision booklet, particularly in relation to what the authorised officers might be observing, might be citing and discussing regarding supervision, as well as a whole lot of questions for reflection and self-assessment. While supervision is not a specific principle or practice within the EYLF or My Time, Our Place, it is embedded throughout the frameworks with references to children's safety alongside opportunities for children to demonstrate agency and safe risk-taking. The following examples highlight how supervision is reflected in the principles and practice of the EYLF. It is part of the way you develop relationships and interact with children, the learning environments you create, and the ways in which you support children's agency and inclusion. Let's start with some of the principles. Secure, respectful, and reciprocal relationships. Through a widening network of secure relationships, children develop confidence and feel safe, respected, and valued. Through partnerships, those ethical partnerships are formed when information is shared responsibly and educators take safety precautions to ensure children's right to privacy and protection. Equity, inclusion, and high expectations. Educators create inclusive environments and adapt flexible and informed practices, including making reasonable adjustments to optimise access, participation, and engagement in learning. So these are just some examples of the principles that are part of the EYLF that focus on children's safety and safety precautions, and also how educators might be making adjustments to the way they are working with children. Let's look at some of the practices. Responsiveness to children. Educators are attuned to and respond in ways that best suit each child's strengths, capabilities, and curiosity. Play-based learning and intentionality. Educators take different roles in children's play or make purposeful decisions about when to observe and when to join in and guide the play. Learning environments. Welcoming, safe and inclusive indoor environments and outdoor learning environments, I should say too, reflect, respect and affirm the identities and enrich the lives of children and families. Well-planned environments cater for different learning capacities and learning styles and allow for reasonable adjustments when required. Although these examples have been taken from the EYLF, there are many similar examples in the principles and practices in My Time, Our Place. And I would really encourage you to be reflecting on those practices and principles, and once again, how they relate to the way that you work with children, develop relationships, create environments, and supervise children. In relation to the learning outcomes, these examples from the EYLF focus specifically on safety and supervision. In identity, support children to learn about and recognise safe and unsafe situations. In well-being, promote body safety awareness with children and families. Help children talk about negative emotions or potentially unsafe behaviours. Discuss health and safety issues with children and involve them in developing guidelines to keep the environment safe for all. Learning. Learn about e-safety for children and embed and model safe digital practices. Plan learning environments that are flexible with appropriate levels of challenge where children are encouraged to explore, experiment and take safe risks in their learning. Alongside these examples, and this is just a very small handful, the learning outcomes in both the EYLF and My Time, Our Place encourage educators to promote learning through being attuned to, responding to children during play and routines, planning and setting up safe, inclusive and stimulating learning environments, using intentional teaching strategies and supporting children's agency. As the age, developmental stages and abilities of children in family daycare can vary greatly, it is really important to be aware of the environment, the available resources, and how your interactions support the diverse needs of each child as they work towards achieving the learning outcomes and the learning goals that are important to their family and community. Effective supervision also needs to be balanced with opportunities for children to have agency, to make decisions, and to engage in safe risks. While educators need to see and or hear children at all times, Enabling children to have more agency as their skills develop is an important part of active supervision. School-age children may need more opportunities to test and challenge their skills while you maintain the safety of younger children. Encouraging children to learn from and assist their peers also promotes relationships and collaboration between children of all ages. This is our first question for reflection, and this is really an opportunity for you to share some of your thoughts in the chat group. Do you feel more confident about how to use the national law and regulations, the national quality standards, the early years learning framework, and My Time, Our Place to guide the way you supervise children? There's going to be a few questions throughout the session, and I would encourage you to use these questions for reflection. They can be used for your own reflection, or you might share them with educators and colleagues to encourage further reflection after the session. So this is really just thinking about the big picture and how we draw on all of those different elements to think about the way that we are supervising children. To address the barriers and challenges related to supervision, you really need to plan the day well. Effective planning for supervision assists you to meet the legislative requirements that we've talked about, but it also enables you to plan and implement quality programs and practices. You also need to plan ahead, particularly for excursions and other tasks that you might need to do weekly, fortnightly, or sometimes less often. And this might also involve formal risk assessments or creating a calendar for long-term plans and events. While some incidents might occur that are unexpected, assessing risks and using a preventative approach is much more likely to minimise hazards and unsafe situations. To effectively supervise groups of children, you will need to conduct risk assessments to determine the level of supervision that is required for particular situations, for example, something like water play or if you're going on excursions. When planning for effective supervision, the following questions might be helpful to just inform supervision when children are in care. You might ask yourself, what part of the environment are the children using? How many children are involved? What are the ages and abilities of these children? What is the visibility and accessibility of the areas or area that's actually been used by the children? What possible hazards and risks have been identified? Asking these sorts of questions can be a great way to prevent any issues from occurring and can really help you to reflect on your practices around supervision. The Sequel website has more information, tools, and templates that you can use for risk management and assessment. Some of you may have also attended the April PD in Your Pocket session on effective risk management and have read the related booklet. These are great resources and will really help you to better understand and manage risks in family daycare. Effective supervision often starts before children have entered your home. There's lots of different strategies that you can use and implement to support effective planning for supervision. And they might include having very clear policies and procedures that address supervision. When you have clear policies and procedures, it makes it much easier to really address supervision. So implementing those required processes and practices means you're much more likely to keep children safe and provide effective supervision. We also need to think about the arrangement of furniture and objects. Placing furniture in a way that lines of sight remain open enables you to see and hear children much more easily. For example, by keeping furniture at waist height or shorter means you can see over the furniture. It also makes it easier for you to move around and view play areas from different locations in the room. You may have to remove or reposition your own personal objects if they are a potential hazard to the children in your care. Think about also having clear and uncluttered environments. Decluttering environments can really help to improve sight and supervision. For example, if windows are kept clear and free from objects that impede your view. Less clutter also enables children to move around much more easily and freely and can avoid potential tripping or coming into contact with potential hazards. Think about supervision plans. planning how the environment and experiences will be actually set up and supervised during the day, particularly some of those high risk or high maintenance activities, ensuring then that you can be available for all children and easily address any incidents that occur while still supervising the rest of the room and the group. You may need to adjust plans and strategies. It's important to be flexible. Flexible supervision arrangements may be needed to allow for supervision of individual children or small groups, such as sleeping children or indoor and outdoor experiences being offered at the same time. Planning experiences ahead of time also minimises the risk of harm and injury by keeping children engaged and focused on safe activities. Think about the resources that you select. If you are working with mixed ages, consider what resources are being offered and when. Small items might present a choking hazard for very young children, however, will be important for the skill development of your older children. The use of these materials might require very close, constant supervision, or should be provided when young children are sleeping or not in attendance. Think about routines and transitions. Developing clear plans for transitions and movement between areas and rooms ensures children are well supervised during these times. You might need to check routes to children's rest and bathroom areas to ensure that they allow access to visible monitoring and do regular checks on sleeping children. Planning for arrivals and departures means you can have conversations with parents while still ensuring that other children are safe. For example, might be offering simple resources and experiences that all children can manage independently, ensuring children that can be seen from the front door, or encouraging parents to come into the main area while other children are playing. Environment scanning. It's important to be aware of what all children are doing by moving around and scanning the environment frequently. When scanning, watch for potential hazards such as open doors, gates, play equipment that might be in an unsafe position or become unsafe, or children trying to enter an area that is out of bounds at a particular time. Think about your positioning. Check your positioning regularly, particularly when you're engaging with children. You should always place yourself in a position that you can see and hear all children. You might want to think about where to stand, where to sit before starting a new experience to really ensure maximum supervision and to minimize risk. A good rule of thumb with positioning is the back to the wall. And that really means that you position yourself to a wall so that you can always see out to the children rather than looking at fences or walls. So it's really important to just think about how you are positioning yourself. So these are some really important ideas that you can think about when it comes to planning for supervision. You also need to think about the times of the day. Be aware of those busy and difficult times of the day that might require a little bit more closer supervision. For example, during meals, during sleep. Try to avoid doing too many things at these times, as this will make it really difficult to closely supervise children that perhaps are eating or sleeping. We've talked about individual needs, temperament, skills, and abilities. It's important to be aware of children who might need more engagement and support. For example, for a child who might need a little bit more one-to-one when they are dropped off. Avoiding those high maintenance experiences at this time will enable you to give the child your full attention while still supervising other children that might be involved in independent play. Listening. It's such an important skill. When we listen and be responsive to children's conversations and play, we can really get a better understanding of what's happening in the room or the environment. Specific sounds, or sometimes the absence of those sounds, might signify a reason for concern. For example, sounds of splashing water, crying, choking, or gasping can alert you to signs of potential danger or children that might be in distress. Listening carefully to any changes in tone or volume in children's voices can also give you some cues and might assist you in supervising children who may not be in direct vision. Prevention. Being alert, anticipating difficulties can prevent situations from arising. Observing children's play, trying to sometimes anticipate what might occur next, is another way that you can ensure children remain safe. So knowing about each child, knowing their abilities, their culture, their strengths, their ideas and interests might be able to help you anticipate what a child is going to do next and also what they're capable of doing. Discussions with children about safety and supervision. Being proactive and talking to children about safety can really help children to start making positive choices about their own safety, including body safety, personal space, and e-safety. This information can also be used to plan and create challenges that children are ready for and support them in succeeding. For example, outdoor play and sun safety. And this might be around children being able to apply their own sunscreen, giving children some of those opportunities to manage their own safety and have a better understanding of their own safety, particularly as they're getting older and have the capacity to do that. This really also helps children to learn about potential hazards and minimise some of the risks to their own safety, not only in your environment, but when they're perhaps in other areas as well. Managing daily tasks. We know it's part of the work we have to do, but try to avoid undertaking tasks such as administrative work or cleaning that might involve removing your gaze away from children. If these tasks need to be completed while children are present, try to involve the children or ensure they can still be seen or are in close proximity. Record keeping. We know it's a part of the work that you do. But make sure enrolment records are easily accessible and are always up to date with the names of authorised people and not authorised people to pick up each child. If you are documenting and collecting information using technology, consider whether this can be done with minimal impact to supervision. Once again, there might be other strategies that you use to plan for effective supervision. And once again, I'd really encourage you to share some of your strategies and ideas in our chat group. When planning for supervision, it is also important to promote children's agency. For example, when an educator allows a child to engage in independent exploration and appropriate risk taking while keeping a close watch, they provide opportunities for a child to make responsible and genuine decisions about their play. It's really important for us to encourage children's agency. We know, this is another key area of our learning frameworks and our national quality standards. And it's important while we do supervise children effectively that we also support their growing sense of agency. The April PD in your pocket on effective risk management in family daycare also has further information on supporting risky play and safe risk taking. So if you didn't necessarily attend that session, that would be a great one to have a look at just to see how you can really give children those opportunities to engage in risky play, safe risk taking, and support their sense of agency. So here's another question for reflection. Reflecting on your current practices, do you now feel a little bit better prepared to plan for active supervision? You can use this question to reflect on your planning for supervision. You might be thinking about some of the ideas that I've gone through, and you might be thinking, they're definitely things that I do or that we do as a service. There might be other things that you think, that's something that we could improve a little bit on, or maybe that's something we need to do a little bit more consistently. So I would encourage you to use these questions for reflection. And once again, you might want to share some of your thoughts, your reflections, your ideas and strategies in the chat group. It's also a great way to see what other people are sharing in that space as well. So let's look at active supervision in practice. Active supervision happens throughout the day, often without you realising you are even doing it. However, there are going to be some specific times of the day that will require some constant, deliberate, and more focused observation of children. That includes meals, sleep, nappy changes, excursions, and transportation. Planning and implementing routines and transitions that support individual children while providing adequate supervision allows children to move around their environment with confidence, being able to predict where they are going, what is coming next, and what they need to do. Good planning also enables you to manage times of the day when you need to deal with multiple tasks. For example, supervising other children while you are changing a nappy or when a parent arrives to pick up their child. You even need to think about how children will be supervised when you need to go to the toilet yourself. So we're going to look at some of these elements in a little bit more detail so that you've got some more information about what's required around some routines and transitions, again, in relation to some of our regulations and standards, but also some good practices. In relation to sleep and rest, since October the 1st, 2023, the approved provider, nominated supervisor, and family daycare educator must take reasonable steps to ensure that the needs for sleep and rest of children being educated and cared for by the educator as part of a family daycare service are met, having regard to the ages, development stages, and individual needs of the children. And as you can see, this is taken directly from our national regulations, Regulation 84A. So, as a family daycare educator, you are responsible for the supervision of your children during sleep, and you need to be knowledgeable about safe sleep practices. Safe sleep policies and procedures also need to be regularly reviewed to make sure they accurately reflect the practices that are occurring day to day. In addition, you need to implement best practice guidance for sleep and rest practices and safe sleeping environments, including sleep and bedding equipment, and ensure there is adequate supervision and monitoring of children during sleep and rest periods. Sometimes you may need to also have difficult conversations with families to ensure your practices are in line with your service policies and best practice guidance for safe sleep and rest, which might be different to what families do at home or what they might be wanting you to do. Red Nose have a resource to assist educators with these conversations, which can be found at rednose.org.au. It's a family fact sheet, and we'll give you some links to that information during the session, and that will also be in the booklet as well. Red Nose recognises continuous supervision in which an educator is in sight and hearing of a sleeping child at all times is considered best practice. Sometimes there might be exceptional or extenuating circumstances or certain service settings where continuous supervision is not achievable at all times. For example, if an educator working alone is attending to another child's needs. Red Nose also highlights why continuous supervision is absolutely essential. Firstly, it's about preventing sudden unexpected death in infancy. Continuous supervision significantly reduces the risk of SUDI, including SIDS and other sleep-related incidents. By staying attentive, you can swiftly respond to any signs of distress or discomfort, potentially averting any dangerous situations. Monitoring the sleep environment. Continuous supervision allows you to closely monitor the sleep environment for any signs of compromise. Factors such as overheating, poor ventilation, or the introduction of hazards into the sleep space can pose serious risk to infants. But with vigilant supervision, these issues can be promptly identified and addressed, ensuring a safe sleeping environment for every child. It's also important to identify changes in well-being. Bedside checks play a critical role in monitoring the well-being of infants during sleep. By conducting regular checks, you can observe subtle changes in an infant's condition, such as changes in skin colour, laboured breathing, or any unusual movements. Detecting these signs early allows, again, for very immediate intervention and can ensure that any emerging health considerations or concerns are also addressed promptly. Maintaining safe sleep practices. Continuous supervision reinforces the importance of adhering to safe sleep practices consistently. You can assure that infants are placed on their backs to sleep in a firm and a flat sleep surface, free from loose bedding or other suffocation hazards. By closely monitoring each sleeping infant, you can uphold these guidelines and make changes if needed. As we know, sometimes you will need to make some changes while a child is asleep. Having those safe practices in place can really help you know what to look for, what to be alert to, and to then know how to manage any potential situations that might arise. Red Nose has a whole lot of information about what to observe during those physical checks and very specific tips for creating safe sleeping environments in family daycare. If children also sleep at different times or are no longer sleeping, it's important to really consider how you're going to actively supervise all children during these times. As you will need to do regular checks of sleeping children, the following strategies might be helpful. So you might want to take children with you when you check on sleeping children. You might want to consider whether children can sleep in the same room as children playing without being disturbed. It's also important to perhaps think about, can you create a direct sight line if children are sleeping in another room? So it's important to be able to see them very clearly and, of course, do the constant regular sleep checks that we've just been talking about. Encourage non-sleeping children to play in one area or room if you need to leave the room regularly. This again will make it a little bit easier for you to be aware of where those children are. And again, you can hopefully have direct sight and access to those children if they're in another room. But it's certainly much easier if they're all in the same room or area. As we've talked about, low maintenance and open-ended activities that require minimal adult intervention and support are really great at these times of the day, because once again, it allows you to go and do those regular checks, knowing that children might be playing in another area, but those activities and experience are not going to necessarily require your constant engagement and interaction. So think about what you're providing to children when you know others are sleeping. Encourage older children to assist younger children when you are out of the room, particularly if you have mixed age groups. And once again, this is a great way for children to be able to show agency, and it's a great way for our older children to have a sense of responsibility and really feel that they are helping and contributing to the care of other children as well. Use of a sleep monitor. You may consider doing that, but even if you use a sleep monitor, it's still important that those regular checks are maintained and done consistently and documented as part of your policies and procedures. Now, you might also have some other ideas about sleep and rest, and I'm sure there are some great strategies and practical examples out there that can really help with supervision during that time of the day or during those routines. And once again, I would encourage you to share some of those strategies that you use during sleep and rest that can really help to manage supervision. Let's look at nappy changes and toileting. Preparing for a nappy change is fundamental to maintaining an adequate level of supervision of children during this routine. So once again, that preparation, making sure that everything is in place is going to really help enable you to not only supervise the nappy change itself, but also other children in your care during that particular time. You need to start by considering what is the best room or place for nappy and clothing changes. It might be on the floor in the same room as the other children, or it might be in another room where you can still view the rest of the group. So you still, again, have that line of sight. You should ensure that all the required equipment is available and within reach prior to beginning the nappy change. You don't want to have to move away or go and get something during a nappy change. So we need to make sure that everything is there, or you would need to take the child with you, get the things you need, and then come back to that nappy change. During the nappy change, as I've said, a child should never be left alone on the change table or mat, and you should always maintain physical contact with the child. That's a really important part of supervising a child during an actual nappy change. Where older children with additional needs may require nappy changing, You might need to consider the adequacy of supervision and the privacy needs of that child as well. So that's where, again, going back to that idea of thinking about where is going to be the best room or place for a nappy change might also be dependent on the child's age. And as I said, if children have additional needs and you're thinking about where that needs to happen. You might encourage older children to help, and that might be around getting another child's bag or assisting a young child to get dressed. We know our older children often really enjoy being able to help other children, and it's a great way again for them to use that sense of agency. So might be a really nice way to get them to help, and makes life a lot easier for you too when some of those older children can assist. Keeping bathroom doors open or ajar to provide those clear sight lines and also really quick access if you need to do that. And simple things like ensuring locks on doors cannot be accessed by children. Once again, with many of these things that I'm going through, they will have already been part of the risk assessments and the plans that have been put into place around what you do in your particular home and environment. But it's still good to think about some of these things and reflect on what's happening within your particular context and situation. And again, what other ideas or strategies you might want to put into place as well to really ensure that supervision is effective during these routines and transitions. Let's think about meals. Supervision during meals is an important part of your role as you manage daily routines and transitions. This does involve having an understanding of safe food handling practices and also just being aware of any changes in legislation, guidance, and practices. You need to use good hygiene practices and handle, prepare, and store food safely. It's also essential to know how to store and reheat food that children might bring from home safely, as children can choke on food, have allergic reactions to food, and get very sick from food that is not stored or reheated properly. Effective supervision also includes clear information for and from families to ensure any food provided is both safe for their own child and others. And this might include individual medication plans as well. Some other ideas that might be helpful during meals. Sitting with children and being close to children during meals will help you to monitor children's food intake and minimise any potential choking hazards. This might seem very obvious, but when you are close to children, particularly during meals, you can really be aware of what they are doing, what they are eating, what's happening during that time. And it really does allow you to monitor that very closely. Likewise, it's important to have mealtime expectations, and that might include things like ensuring that children are sitting and not moving around while they are eating slowly. All of these things can make supervision easier, and they can also help children to actually learn about their own health and safety and why it's important to do those things. Why is it important to sit while you're eating? Why is it important to make sure that you are, chewing your food and eating slowly? I would also encourage you to, help children to set up meal areas as well. Encourage them to help you set up for meals, prepare simple food, and clean up when they have finished. These are great opportunities to also talk to children about food safety, health, and well-being. If you're actually eating hot food and drinking hot beverages with and around children, it's important to consider how you do this safely while still providing effective supervision. You will need to ensure that hot beverages are in closed containers that cannot spill, and hot foods are kept away from children. If you're heating food for children, you must ensure that it is safe temperature before feeding or providing it to children. While eating with children can offer opportunities for role modelling and discussions about healthy eating, it is essential to ensure that the health and safety of children is prioritised during these times. So we really want to make sure that we are doing many of these things sitting with children, being close to children, thinking about what we're doing ourselves. The role modelling is really important, but also encouraging children to be part of mealtime preparation and having conversations about food safety and health. With all of these things that we're talking about throughout the session, the more we can encourage children to also learn about their own health and safety will also make it much easier for you to supervise if children are aware of many of these things themselves, and particularly as they're getting older, that they can start to manage some of these aspects themselves. Let's look at excursions. So under the Education and Care Services national regulations, an approved provider must ensure that there are policies and procedures in place for managing excursions. Regulation 168, and that we also take reasonable steps to ensure policies and procedures are actually followed, and that's Regulation 170. The policy and procedures must include the following: conducting a risk assessment before each excursion to identify any risks that might affect the safety, health and well-being of children, as well as how the risks will be managed. And this is in Regulations 100 and 101. Conducting periodic new risk assessments for regular outings. Obtaining authorisation from families or authorised nominees, Regulation 102. So we need to make sure that those policies and procedures are in place and that risk assessments are conducted for excursions. And that does include for regular outings. And as it says there, it's not just about doing that once a year for a regular outing. It's making sure that those risk assessments are done regularly to just make sure that any other considerations are in place around those regular outings, particularly as we know, things can change, and that might be weather, it might be what's happening out and about in the community. So important to make sure those periodic assessments are done. The risk assessment will need to take into account the levels of supervision and the number of adults needed for the entire time the children are out of the service, premises, residence or venue. Volunteers, such as parent helpers, can also assist to provide additional supervision. However, you probably want to make sure that it's very clear what their role is and also, what they're going to be doing during that time. And we'll talk a little bit more about that as we go through the session. Using an excursion risk assessment management plan, such as a template on the ASEQA website, is a really good tool to organise and do a risk assessment. You might have also attended the PD in Your Pocket session in April on effective risk management, or you can refer to the presentation and booklet if you missed that particular session. But there's certainly lots of information about that in that particular PD in Your Pocket and the related booklet that's part of that. When it comes to excursions, there might be some things that you need to consider, particularly when it comes to effective supervision. First and foremost, being familiar with the required policies and procedures for excursions. Ensuring the risk assessments that we just talked about are carried out and implemented, and also, if need be, that they are done on a regular basis or updated if there are any changes around the risks associated with that particular excursion. Creating an excursion checklist of all the tasks and items needed throughout the process. Again, this is really about preparation and planning. So the more that you have planned in advance, the more that you have exactly what you need in relation to going out on an excursion, it's going to make it much easier. It's going to ensure that you have everything that you need. It's also going to ensure that you are meeting all of your policies and procedures. You might want to create an excursion run sheet, and ensuring you and any volunteers have a copy. And this can be great if you do have volunteers as well, so that they're really clear exactly what's going to happen when, and perhaps, some of the processes that might sit around what's going to happen during that excursion. Also ensuring that your volunteers understand their roles and responsibilities on the day and through an excursion supervision induction prior to the excursion. So really important if you have people joining you on the excursion, that they are very clear about their roles and responsibilities, and particularly around supervision. We know often that, if people come on an excursion, they really want to often be with their child, if it is a parent particularly, and want to spend a lot of time with their child. But it's also important to make sure that if there are other roles and responsibilities that you want them to carry out as part of the excursion, that they are very clear about that, and what that means also around their engagement with their own child and with other children during the excursion. Creating an excursion review template is also a great way to reflect on excursions as well. And not only the educational value of the excursion, but it's also a good way to then think about some of the health and safety issues. And are there other things that then need to be noted for future excursions? And that's where, particularly if you are going on regular outings, it might mean that there is something you need to just be aware of when it comes to those particular regular outings, and something you may need to change going forward. There may also be other processes or other tasks that need to be implemented prior to, during, and after an excursion to maintain active supervision and ensure children's supervision. Now, this is obviously going to be very much contextual. It's going to be about what that excursion involves, where you're going, and who's coming with you. So there will be other things that you really need to think about and reflect on when it comes to supervision around excursions. And that's probably going to be quite different for every single excursion. And I would encourage you also, even if you are going somewhere that's not only a regular outing, but perhaps you've been before, it might be something that you do annually. Once again, to make sure that that risk assessment is reviewed, that you are really looking at any other potential hazards or changes that might have taken place around that particular excursion. So that can be incorporated into the risk assessment, but also into your supervision practices around that. And again, if you need to share any information around the roles and responsibilities for any volunteers that might be joining you on the excursion. Transportation. Children can be transported by or be on transport arranged by children's education and care services, and that of course includes family daycare educators. Transportation can present some heightened risks to children's safety, in particular during the period of moving between transport and embarking or disembarking from a vehicle. While new requirements for regular transportation from the 1st of March 2023 apply to centre-based services only, it's really good practice for family daycare staff to apply the new requirements to minimise risk and ensure the safety, health and well-being of children during any periods of transportation, I should say. Family daycare educators and providers should consider establishing clear and consistent procedures through effective risk assessment that ensure children are not left in vehicles when the family daycare educator or family daycare educator assistant is transporting children. So once again, while this is something that is not directly applicable to family daycare, it is really best practice to look at what this might mean for you and for your particular service, making sure that if transportation is occurring, what is going to be really good practice around that, and considering supervision. As it said, we know that often getting from the house to the vehicle, disembarking vehicles if children are being taken to another place, are the times that often we have some really high risks. So really important to think about those times and how those risks can be mitigated and addressed, and how children are going to be supervised during those times, because we know, you might have a child who's out of the car while you're still actually getting another child out of the car, removing a seatbelt, or, doing one of those things. So it's important to really think about what that's going to look like and what's going to be best practice around transportation. For further information on excursions and transportation, you can refer to the recent PD in Your Pocket Safe Arrival, Transport of Children and Family Daycare Transportation that took place in June. some of you may have attended that, so you might have also picked up some really good ideas and practices from that session. So I would encourage you, if you didn't necessarily attend, it might be one to have a look at as well. But also you can see on the slide here, there's some different websites and links about transportation and road safety that I would encourage people to just have a little bit of a look at yourselves. And you can see there's some really important considerations to think about as well, and particularly the look before you look as well, which is one that I would encourage people to just tap into and just be really, really mindful. So there are many other times in the day when supervision may require further planning or specific processes to keep children safe and minimise potential hazards. So while we've looked particularly at some times of the day around routines and transitions, I know there are going to be lots of other times as well where you really need to think about supervision. And as we've said, supervision is really happening all the time, throughout the day. It is part of what you do as an educator, but there certainly are going to be moments where you are really going to have to be perhaps a bit more vigilant, a bit more mindful, really think about, plan for supervision during those times. Obviously, your residences, the venues for family daycare are all going to be very different, but it's still important that you are really aware of the regulations and the standards and how they apply to your particular setting. So once again, the clear policies and procedures are going to really help. Having very thorough induction processes so that all educators are really clear about what is expected of them and what they need to follow in relation to policies and procedures. The risk management, the risk assessment that we've been talking about is really important. And while a lot of that will be done before you're up and running as a family daycare educator, that still needs to be consistently reviewed and reflected upon as you continue in that role. That ongoing evaluation is really important. And doing all of these things can really help services ensure that everybody has the knowledge that they need and the skills needed to really supervise children effectively in family daycare. So some of these things are going to be really, really important for you to think a little bit more about. And now, once again, I would encourage people to share ideas that you might have about any of these routines and transitions that we've been talking about. And please pop them in the chat group. And if you've got some questions too, as I said earlier, they might be answered by some of your colleagues. And we are certainly going to have a little bit of time to potentially answer some questions as we're sort of drawing to the end of tonight's session as well. So this is your final question for reflection. And once again, I'd really encourage you to share your thoughts and also any changes that you plan to make in the group chat. So I know some of you will have shared some thoughts already, but there might be some things that you can take away from the session, some of the things that I've suggested as well. And once again, I would really encourage you to look through the booklet as well, because there's a lot more information in the booklet that goes with tonight's session. And so that will also be available, and many of you will have accessed that already. So I'd really encourage you to have a look at that. But this final question, will you make changes to improve the way you actively supervise as a result of this PD session? Now, as I may have said at the start, I think the PD session is very much about giving you some new ideas, some things to think about, some opportunities to reflect on your current practices, but it's also a really great opportunity for you to feel some of the practices that you already do are affirmed, and that you can really walk away and say, these are some things that we already do. These are some things that I do as an educator or as part of a family daycare service. And, it's great to know that we're doing these things. And even from the start of the session, knowing that so many of you are really aware and feeling very confident about supervision and what it means in practice, but also how some of our regulations, standards relate to that as well. So I would encourage you to share some of your thoughts and maybe any particular changes or things that you're thinking about making around supervision in the group chat as we do sort of start to come towards the end of our session. Now, in conclusion, adequate supervision is a really key part of your role when caring for and educating young children. And as we've said, it really goes beyond just the legislative requirements and standards. So, we have all of those in place to support us, to enable us to know exactly what we need to do in terms of policies, procedures, and day-to-day practice, what is considered best practice, what is considered high quality standards. But we also need to really make sure, as we've said, that it's more than just adequate supervision, because when we are actively supervising children, it means that we are really engaging with our children. We're really tuned in into what our children are doing. We know them, we're aware of them. And it also means then that, we can ensure that children are protected, they're kept safe, but that also children can learn, they can develop in an environment that's going to be safe, that's going to be secure, that's going to be really stimulating. So we need to think about what that means through risk management, through thoughtful programming, through active engagement. You can really plan for and implement supervision that is active and effective. And this in turn can really create a safe place for children to grow, to be nurtured, and to develop agency about their own health and safety. So I'm going to now just open up the remainder of our session, or maybe the next 10 minutes or so, for some questions from people. Some of you may have put some questions in the chat space, and I'm going to just have a quick look at the chat space. So what I would just like to ask, if there are particular questions that people would like to ask, please do. And one of the things that I also did forget to mention at the start of the session, I think we did say that there was going to be an interview with a family daycare educator, and unfortunately that wasn't able to occur, and we haven't been able to include that in tonight's session. So that's why we are more than likely going to finish a little bit earlier tonight, but I'm sure there'll be no issues with that. But if there are any questions that people have, or anything that people would like to particularly ask, please pop it in the chat space. And I'm more than happy to answer any of those questions. I'm just having a little bit of a flick through the chat space now, just to see if there's any questions. There's lots of thank yous, which is fabulous. Any burning questions out there? Great. And look, I've looking at some of the responses, and certainly I can see some comments that it's been a great refresher. And once again, I think it is sometimes important for us to just refresh. Some of these things that we've gone through tonight might be things that you are aware of, that you already know, but just going through them again and having access to this information and the related booklet will hopefully just remind people of what we need to do, and perhaps what we need to just think about in relation to supervision. I'm just going to see again if there's any questions. I'm just continuing to look through the chat space. While that's going, I'm going to just come back to the slides, and I'm happy to answer some more questions as well in a moment. If if anyone's got any further questions. So again, another just quick reminder about the Online Educator Forum that's coming up on the 26th of October. We would encourage you to have a look at that and perhaps register for that session. And also, please remember that you can participate in the Facebook group. I know that many of you are already part of that. If you haven't already joined, I would encourage you to open Facebook if you are on Facebook and type in PD in your pocket, and you can gain access to that, because that's another really great way to be able to connect with other educators, share information as well. So you might find that really useful too. Now, once again, I'm just going to quickly go back to the chat to see if there are any other questions that people might have. Just having another little quick look. So I'm happy to just stay online for a little bit longer if there are some questions, but certainly for everyone that's been involved in the session tonight, I hope it has given you a few new ideas and maybe a few insights about active supervision. I'm sure it's also affirmed many of the practices and things that you already do around supervision, but hopefully it's just given you a little bit of food for thought and some things to reflect on as well. But I would really like to thank everyone for participating in tonight's session, whether you've been watching or listening, if you've been contributing to the chat group. Thank you very much, because I know people get lots of ideas from one another as well. So hopefully you've also gained some really good ideas and insights, not just from me, but from other educators as well. So I'm going to just continue looking through the chat space. And if there's any other questions, as I said, I'm happy just to be available or to answer any questions for the next 5 or 10 minutes. There's been a couple of quick questions that have come up. I just saw one about a child sleeping on their back, but continues to, around sleep, sorry, and I'm just going to go back to the question. I'll probably lose it now. But it was certainly about moving a child, making sure they are sleeping in the right position, but then the child moves themselves. And again, what I would really just say is to keep moving them back. I know it is sometimes difficult because children will move and have preferences in the way they sleep, but again, important just to follow the procedures, the regular checks, keep moving the child if you have to make sure that you are doing exactly what your policies and procedures require around safety when it comes to children's sleep. Sorry, I was just going to say, if there are further questions too, I would also encourage people to be, talking to your leaders and to your colleagues, to other educators, because you might find too that you can probably get some good information from your approved providers, from your service leaders, and even your colleagues as well. Yeah, a couple more questions have come up around sleep as well. And I know it is tricky if you've got a group of children who are perhaps quite active and maybe not being all that quiet when another child is asleep. You might want to talk to the children about, how they can try and perhaps do some things a little bit more quietly, or perhaps try and come up with some ideas and experiences or activities that involve children being a little bit more quiet. So it might be perhaps just thinking about the experiences and what's on offer or what you're doing at that particular time as well. Are there any other questions? I may have missed a couple as we've gone through, because so many comments and some questions are coming up, but they're going quite quickly, so I may not be catching them all, which is why, as I said, I'd encourage you to, yes, talk to your colleagues, talk to your service leaders, your approved providers. There's a wealth of information out there through both the Department of Education and Peak training as well. So please utilise all those wonderful resources out there, and all these PD in your pocket sessions, some of the recent ones over the last 12 months have also addressed aspects of supervision. So you might find going back to some of those sessions really helpful as well. Great. And I can see someone's put in the chat group about a course that's around advanced safe sleep for early childhood. So you will also find that there are going to be other wonderful courses and resources and information out there that you can access. As I mentioned, the Red Nose organisation is a great great organisation when it comes to sleep and safe sleeping. So I would encourage you to access their website and the information that they have available around sleep. I can see a question has actually just gone up about supervision strategies when educators need to use the toilet themselves. And I would encourage people, if you're still on, to pop some ideas into the chat group, because I imagine there are lots of different things that people do. And, it might be as simple as sort of keeping the door ajar so that you can hear the children. I've certainly heard of educators also encouraging children to perhaps sing a song while they're in the bathroom, and that way they can hear all the voices and know that children are nearby and still being able to be supervised during that time. But as I said, please pop any ideas or that you might have around that as well, because it is something you have to do every day, and juggling how you supervise children during that time is important to think about. Okay, well, we are actually now getting close to the official finish time. So thank you to everyone who has been throwing lots of questions and ideas and strategies into the chat group. But what we might do is, in literally a minute or so, we might close the session. So again, I'd like to just thank everybody for participating, whether you've been watching, listening, contributing, or just taking in all the ideas. Thank you for being part of tonight's session. As I said earlier, I hope it has given you a bit of food for thought, some ideas, and also some affirmation around many of the practices that you already have in place. So thank you all very much for joining us tonight for this PD in Your Pocket session. Thank you.